Hello, and thanks for joining us for our Founders Live session. My name is Madia Logan. I'm the Chief Member Officer for Indigenous Health, and really excited to talk to you all about what's going on in the company and what's going on in our community. First, let me bring in our other speakers. We have Yusuf Henriquez, our CEO. Welcome, Yusuf. Thank you for joining today. And Dr. Bradford Wilson. And let me make sure I have everyone off mute. Welcome. Thank you, fellas, for joining me. How's it going?
Great.
Going well,
Great. Well,
thanks.
with so much, say that one more time. I'm sorry, Brad.
Saying going well, thanks.
Great. Glad to hear it. Well, with so much going on, I want us to jump right into the subject because we have a lot to discuss. As we saw earlier, it is now Minority Health Awareness Month. And so we're really excited about this focal point for just the community talking about Minority Health Awareness Month. Before we jump into the subject matter, though, I'd like us to move to Yusuf Henriquez, our CEO and founder, just to give us some updates on Indigenous Health. Yusuf?
No, pleasure. Thanks, Madia. Great seeing you and Dr. Wilson. Yeah, a lot of exciting things. As you know, just recently returned from a trip to Africa, where was able to see what are some of the I think global health disparities and health conditions and issues that minority communities face both here and abroad. And so, it gave me that sense of urgency to really start, again, with the team that we've assembled here to start getting out in the communities that are mostly affected by these health disparities, both here and across the pond in other countries. So a little update, Indigenous Health is still moving forward with, getting some finality to our web and mobile application, which is our Buyers for All campaign around the Genius app. The app is in its final stage of, having a few tweaks. We had the pleasure of having a focus group with selected key individuals that have been involved in a lot of the user experience testing, and we had some feedback over the last week that's now being implemented. And then we move into, as you know, the compliance and validation and UAT testing, which is required for live production. So feeling confident that we're going to have a platform that's very engaging, be able to have our members in the community from the different disease areas to interact and have a great experience within the app. So still spending a lot of time to make sure that that first engagement and user experience with the application is going to be one that's memorable. On other fronts of the company, just, again, continue to do fundraising, raising awareness, and also, Madia and other members of the team have been out in the community, engaging with different stakeholders and engaging with different members from a political side that are engaged in health and want the betterment of health outcomes for minority individuals. And then lastly, really looking forward to start having more in-person events. I think start to have more engagement and a lot of the ability to interact in small or medium-sized group that will help for us driving our Buyers for All campaign and message here in the local and regional area. Looking at future's bright, looking forward to the discussion today around minority health. This is one of the pillars of why Indigenous Health was created. And so want to make sure that we're engaging our the members of our community best as we can, informing them with key information. So thanks.
Yeah, absolutely. And I think that's a perfect segue into highlighting into Dr. Wilson talking to us a little bit, just launching the topic of Minority Health Awareness Month. So Dr. Wilson, could you talk to us a little bit about Minority Health Awareness Month, just kind of the origins and why this is so important and central for Indigenous health?
Well, I think it's important that we kind of put it into context, properly first, right? When we typically, the term minority is one is usually referring to the part of the African diaspora in terms of African Americans in the U.S. and in the States, where we, were, considered to be, a minority population with regards to the total population of the country. But when we talk about the issues that folks in what we refer to as minority communities face, these are issues in terms of health issues. These are issues that African populations across the African diaspora are facing. But in the context of their parts of the world, or their regions of the world where they may not be minorities. So I think it's important to say that when we talk about minority health, we are not only talking about folks, the part of the diaspora that's in the United States in terms of African Americans. We're talking about these same issues that are impacting other populations across the diaspora that in their context and again, in their regions of the world, they may not be minority populations, but we're still referring to those same issues that are impacting those populations, even though they're in a different context in terms of them not quite being minorities in that regard. So, so when we talk about minority health in the U.S., it's just I think it's born out of the health disparities that we've observed and we've been talking about for a long time, in terms of issues that disproportionately impact African Americans and Latino and Hispanic and Latinx populations. And what we can also, apply another label to is underserved and or underrepresented populations, particularly when we're talking about the history of clinical trials where 95% or more of the populations in clinical trials are traditionally European males. And and then that kind of sets the standard in terms of their participation in those trials, in terms of, or that has traditionally set the standard of how the findings have been applied. It's been, the trials have been conducted in these groups, and then with things that are found okay to be in that group, or then just assumed to be okay for everyone else. But then, after the fact, we have folks who engage or interact with some of these, products, and then they have experienced adverse effects because they weren't represented in those clinical trials. So when we talk about minority health, we talk about a focus on these underserved and underrepresented populations, and a focus on and looking at things through a lens from a perspective that's, that places these populations at a priority because of they've been traditionally underserved. So in terms of the exact origins of Minority Health Month, I'm not quite familiar. Some we know about like Carter G. Woodson and how he was kind of instrumental in initiating what we now know as Black History Month. But with regards to Minority Health Month, I'm afraid I don't have that in my body of knowledge to share with our viewers and you. But it's again, just born out of a need to address the disparities that are disproportionately impacting these communities.
Right. Right. And I saw so there are a lot of resources available, and we've been sharing them. If you haven't followed us yet on social, we're all over it. So you can follow us on LinkedIn, on what is this side? Okay, so you can follow us on LinkedIn, Facebook, Twitter, and we have all of this information. So over the course of the month, we'll be presenting minority health facts, we'll be presenting information. And Dr. Wilson is right. There are several communities that are addressed, in this awareness month. And so one of our team members actually lives in Hawaii, and she was citing and pulling out some of the Pacific Islander imagery that they had in there. So it's really great. It's very diverse. I think that the team there has done a really great job of pulling together resources, and we're going to be sharing them and amplifying them on our platform. But I wanted us to move quickly to the next topic, which is Black Maternal Health Week. And we're excited to be supporting that as an enterprise too. I thought I was going to have to pull in some pictures of when I was like 209 pounds and going in to deliver my son. But thankfully, we have some other mother stories to share. And we're really excited to support Black Maternal Health Week as a Black-owned company. And me as a Black woman and being one of our co-founders, it's so, when you look at the statistics on this, and Dr. Wilson, please jump in, but when you look at the statistics on this, as a Black woman, I remember going into labor and being afraid for myself, feeling like I had to advocate for myself, although I was also in a tremendous amount of pain. So, Dr. Wilson, could you highlight Black Maternal Health Week for us and talk to us a little bit about that, just from your knowledge?
Sure. I mean, again, it's an unfortunate another example of the disparities that exist in the healthcare system that we have access to here in the States, and unfortunately, it's probably something that happens in other places as well, with regards to the different standards of care, different levels of care, and not standards of care, I should say, but different quality of care, I should say, that can sometimes be experienced by women of color when they go into the hospital or into labor, with regards to the treatment that they receive, particularly treatment for pain through the labor process, which we can trace back to some misperceptions that are kind of been ingrained in that specialty of medicine, that were kind of born out of some very unethical practices by individuals like the likes of J. Marion Sims, who conducted experiments on enslaved African women without the use of anesthesia, and is the so-called father of obstetrics and gynecology. And in the remnants of that even being seen as recently as 6 years ago in polling medical students and their perceptions about how Black people perceive pain. So those are unfortunate things. And then but then the hope and the silver lining in this particular case is that often that when Black women are treated and are cared for by physicians of color, a lot of these things that we observe in terms of these maternal health issues are often eliminated because of, I guess, the different type of rapport and different type of relationship and different, sensitivity in the care and the different, cultural sensitivity in as being provided in the care by these physicians. And, it inspires more communication and better rapport during the patient, and it results in better outcomes in these cases. So that is the silver lining in this case. And then this is why we need this is why it's going to take a village for this thing, things that we're talking about here. And it's going to involve our clinicians of color, our other clinical care providers, our nurses, our pharmacists, our physical therapists. We need, folks that are members of our communities to all kind of rally around, our cause, and kind of, take the initiative, right, to improve the health outcomes for our folks, because we've been talking about it for so long, and we've seen advances in some cases, but the progress is, we all think it could move a little faster.
Mm-hmm. Mm-hmm. As parents, I know we all have a perspective, but what can you, or Yusuf, even if you want to jump in and share just what the significance is for you all? And I know you all have also been a part of some of the events that have been going on this week in celebration of Black Maternal Health Week. So is there anything you just, either of you would like to share about the personal experience? I don't want to speak to it, but I'll just briefly share that one of our other co-founders, Michael Akinyele, talked with us on camera about his experience being a parent as well, and kind of having some fear for his wife as she walked through that process. So as you all walk through the process, as so knowledgeable folks in just the health field, what was that experience like for you all?
Yeah, again, I think, focusing on some of the misconceptions, as Dr. Wilson mentioned, within the healthcare space. Me being a veteran, there are certain specialized care that I need that normally is not offered in the commercial setting. So, the VA health system is one that I frequent most often. Predominantly, most of my military career, I've been in military healthcare system. And so, yeah, the misconceptions of how how we're looked at as far as, pain rating has always been something of concern, even with myself. Again, one of the biggest problems I have is, a lot of my injuries from the military are musculoskeletal. However, I am 210, pretty solid guy. And so when you walk into an emergency room and you state that you have pain,
Yeah.
you have to damn near look like you're like cuddled up or curled up in order. And I'm sure Brad goes through this as well, where, your level of pain is kind of disregarded because of how you look. I got a high tolerance for pain because I've been, dealing with these medical conditions for a long time, military. And so, you'll see that level of kind of disregard to certain, exhibited symptoms, because, what you're telling the doctor is not what he's looking at, right? He's looking at,
Right.
African American male, pretty decent shape. And I'm not like, with tears in my eyes saying that I'm in pain. And so, a lot of times, those things kind of get overlooked. And so you then get, kind of put into this bucket of having,
Right.
that perception. As a father of 4 daughters, I also go through that because I'm the one that takes them to the doctor as well. So that's also been a unique experience for me to look at, again, making sure I tell my daughters to speak up.
Mm-hmm.
As you were talking, I equivalent this to, mechanics and how they treat women versus male when you go do your
Mm-hmm.
car checkup, right? Same thing with your body, I think we've seen the missteps by politicians trying to tell women what to do with their bodies. It's the same thing. As you know, the statistics are what, about 91% of the physicians in the US are white, male and female. So you could see through the lens of, if you don't have a minority physician, you could kind of see how some of the things that are culturally represented in some, demographics get missed and overlooked. Because, I mean, what does a Caucasian physician know about, individuals that's from the islands, unless they're in a populous area where they treat a lot of African Americans. They
Right.
won't. Yeah, they won't have that understanding, and so I think those are some of the things that have been really concerning for me going into the
Mhm.
future. Now that we're adding artificial intelligence, that again, although they are algorithms, they're also created by predominantly white males in the field. And so you'll start to see where they did a study where individual women of physique that's in the African American culture have been scanned as men by these particular technology. So
Really?
yeah, again, because of the affect and individual that are developing. So that's another area that Indigenous Health will be very cognizant of, is to make sure that we're spot checking as we move to more precision medicine, and again, moving into a more automated way of care. We have to be concerned around some of those things, and it trickles down. So yeah, I've been a big champion with my daughters to kind of tell them, again, you kind of make sure
Speak
that
up.
the doctors are hearing what you're saying,
Right.
because they've had instances where I've had to get on the phone with their doctor, even though they're 18, while they were in college, because she told the doctor she had XYZ symptoms, and he kept telling her that she had it's something else, and
Mhm.
so my kids have kind of been, it's been beneficial to them to have somebody in the household that they could get on the phone and call.
I'm sure. I'm sure. Well, we have a couple more topics left, and I want to, Dr. Wilson. April 10th was National Youth HIV and AIDS Awareness Day. And I wanted to bring the conversation back around. We talked about National Minority Health Awareness Month, and within this month is National Youth HIV and AIDS Awareness Day. Can you talk about why this is so critical for the community and Indigenous health?
Sure, but if I could touch on the last topic really quickly, I
Of
would be
course you can. Always.
just wanted to definitely shout out to the organizations that we're working with in the area of women's health, in terms of this week being National uh, Women's Health Week, and looking at specifically referring to a PCOS Challenge, Sasha Adi, and Endo Black, with Lauren Cornegay, and with the White Dress Project, looking at fibroids with Tanika Gray Valbrun. Definitely like to want to shout them out. Actually, two of the three organizations had an event earlier this week, uh, and in recognition of the week, and
Mhm.
just to real quickly give a little bit of insight on my situation when it was time for my son to be born. We had a clinician of color, so fortunately we were able to have that type of relationship with our clinician, and I was a medical student at the time, and wanted to be the person to actually deliver my son. So we worked closely with her for me to do that. So we really didn't, and there were some issues during the pregnancy that caused us to actually induce the labor of my son. There were some signs of preeclampsia happening. So in recognition of that, we elected to induce the birth of our son, and go through that. So fortunately, we didn't have the advocacy issues because we had
Mhm.
a female clinician of color at that. So we
Oh,
were
wow.
fortunate to really we were fortunate in that regard. But in terms of the next issue, in terms of looking at HIV, when we talk about
Mhm.
world health, we really have to talk about um, health issues and and like HIV,
Mhm.
it's completely something completely different than it was when it first made its appeared on the scene. It's gone
Mhm.
from a terminally ill infection to essentially a chronic disease, a chronic condition.
Mhm.
But it's still something that although it's no longer fatal, is something
Mhm.
that can well, if encountered, still requires medication, perhaps um, for an extended period of time, and in some cases maybe a lifetime. Although there have been lots of advances there as well, right, where people
Mhm.
are you know have non-detectable viral loads, meaning that when tested for these, you cannot detect the presence of the virus in their body. But
Right.
even though we have all these advances and it's no longer fatal, it's still something that's pretty preventable, right? Pretty avoidable, and decisions that are made, you know, uh, uh, can really impact your exposure to
Sure.
HIV, and it's important for youth to understand that they can save themselves a whole lot of headache, just by making some smarter decisions and some decisions that are going to protect them
Mhm.
from exposure, from unnecessary exposure to something that is is something that, if it's
Preventable.
something avoidable is something that you would think that folks would want to make the decision to avoid if they can. But just talking to the youth out there, uh, just one of many things that just with some smart decisions that you can. There's enough plenty of other things out there that you're gonna have to face. Why not eliminate the ones that you have control over.
Yeah. Yeah. Great. And agreed. Agreed. Well, I know we only have a couple of minutes left, and we wanted to talk very briefly, just to include World Parkinson's Disease. Parkinson's disease is another illness that affects members of our community and is pretty complex. Any connection, Dr. Wilson, you can build for us between those topics, and then talking a little bit about Parkinson's disease?
Well, right. Because of the advances in treatment for HIV, and and the advancements in medicine, folks are living to the life expectancy of folks is getting longer, and folks are living to a
Mhm.
longer age or older age, and then as a result, issues and diseases of aging are
Mhm.
more prevalent because you have a larger portion of the population that are being impacted by these types of things, as our population, you know our population ages. So
Right.
when you talk about longer life expectancy, then you talk about things that can happen over time, and we talk about some kind of neurodegenerative type of diseases, and when they can impact your ability to your movement and your cognitive abilities as we get older. And Parkinson's is one that it affects a certain part of the brain that's involved with movement, and
Mhm.
one of the symptoms is tremors, and it's also a part of the brain that kind of produces the neurotransmitter dopamine, which is a pretty important one. And
Mhm.
because of these cells that produce this dopamine are have essentially are essentially dying, and the impact on the brain, it's there's multiple impacts on the brain, but one of the most recognizable ones is the tremor that folks
Right.
who have Parkinson's, um, is one of those signature symptoms and signs of Parkinsonism. Um, but also it has some impacts on cognitive abilities as well. But again, it's kind of, what we see when our population gets older. And so then there are more folks living longer. And as a result, there are going to be more folks impacted by conditions related to aging.
Got it. Got it. All right, great. Well, thank you for sharing that. Just before we close out, I know we're very close. We're a little bit over our 30 minutes, but I want to thank you all again for sitting and talking with us. We're really excited to continue celebrating and raising awareness around National Minority Health Month. April is National Minority Health Month, and it's a time to raise awareness about health disparities that continue to affect people from racial and ethnic minority groups, and encourage action through health education, early detection, and control of disease complications. We also have that the origin of National Minority Health Month was in 1915 in the establishment of the National Negro Health Week by Booker T. Washington. So you were right on, Dr. Wilson. Thank you for that. Any closing comments you have, Yusuf or Dr. Wilson, before we end?
No, thanks everybody for tuning in. Looking forward to providing more updates as we move into what we considered some critical moments of us building out these ecosystem. As Dr. Wilson mentioned, stay tuned. We're working with what we think is a very vital and critical community, which is the endometriosis, PCOS, fibroids community in our Black African-American women population here in the U.S., looking to start building a strong partnership with that group so that we could really get to some of the issues around those different disease areas. Just an enlightenment. I had a call with a technology company about 2 or 3 weeks ago, and I mentioned that we were going to be working with these 3 particular groups, and there was 4 women, all in the IT, technology, engineering space. And what was compelling to me, and to know that this is, what Indigenous Health sets their mission and goal on. Each one of those women were part of those 3 groups.
Wow.
And that was very compelling for me. So, while we had already considered those 3 areas as a very compelling area for women's health, particularly, it was, I think I became mute at that point, being the fact that what is the odds of having 4, and these were women of different ethnic background, Indian, African-American, African, and all 4 were a member of all 3 of those organizations, at least 1 or 2 of those organizations. So that kind of gave me the statistics that I need to kind of understand and know that this is a very important area for women's health, which I think falls into also maternal health. Again, because with the capabilities of women reproductive as well. So yeah, for me, just wanted to leave the audience with that, just to understand how important what I think Indigenous Health is doing, and how important Minority Health Awareness Month is, to identify these particular disease areas that are really impacting the women and men in our community. So pleasure for joining. I know we're a little over, but I'll turn over to Dr. Wilson if he had any closing comments.
Just wanted to echo the sentiment as well, and thanking the folks for joining us. And, looking forward to, having more of these discussions and highlighting more of the issues that are impacting our communities, and talking about the things that we're going to be doing about it. That's what's exciting to me. The things that we're going to be potentially have the capabilities to do going forward.
Yes, that action. That's wonderful. Well, thank you all so much. We will see you soon on our next Founders Live. But tune in. We are going to have Dr. Cameron Matthews on the 18th, and it will be a rebroadcast, but it's a very exciting Founders Live episode. And the founders, all of us are on, all of us are talking. And so it's a really good one. So please make sure you watch that. We also have some live events that will be happening so far in the DC area, but we're going to start expanding. And we're also looking to get out into community health events. So if there are events you know about, drop us a line and we will try our best to attend. Thank you all for joining us today, and we will talk to you soon. Signing off.
Take care, everyone.
All right. Bye. Thank you all.